Imagine this. You've got a horse, and they're eating well, getting plenty of good feed, looking, perfectly normal on the outside, but slowly, almost imperceptibly, they start losing weight. Their coat maybe loses its sheen. They just don't seem quite right. And you're scratching your head wondering, what on earth is going on here?
Yeah, it's a really common mystery, actually. And often the answer lies hidden somewhere you just can't see deep within their digestive system.
Exactly. And that's our deep dive today. We're going to unpack this fascinating and often misunderstood world of equine intestinal malabsorption. Our mission really is to understand how horses absorb those vital nutrients from their food, what exactly happens when that crucial process breaks down, and how veterinarians use some, well, remarkably clever diagnostic tools, specifically these sugar absorption tests, to uncover these hidden problems.
Right. We'll start by defining malabsorption, then explore its sometimes surprising signs and the underlying causes. After that, we'll take a really close look at those sugar absorption tests, understanding what makes them such powerful diagnostic detectives.
And finally, we'll connect it all to the bigger picture. What are the crucial next steps after these tests to get a complete diagnosis and hopefully help that horse thrive again? So yeah, let's pull back the curtain on this complex bit of equine biology. So to kick us off, when a horse isn't getting enough goodness from its food, even when it's eating, vets often talk about something called malassimilation syndrome. What exactly does that mean?
Okay, so that's kind of the umbrella term, right? And it actually breaks down into two core issues. First, there's maldigestion, which is basically when the horse's body fails to properly break down the food into smaller, absorbable units. Think of it like trying to blend a smoothie, but the blender just isn't quite chopping everything up small enough.
Okay, makes sense. And then there's malabsorption, which is our focus today. So the food has been broken down into those smaller pieces, but the body can't actually absorb those digested nutrients into the bloodstream. Is that it?
Precisely, yes. And here's a key insight for horses. Malabsorption is actually more common than maldigestion. The small intestine is really where all the magic happens. It's the primary site for absorbing most vital nutrients. Simple sugars, amino acids, fats, vitamins, minerals. When that small intestine is compromised, that's where the real trouble begins.
Right. So if a horse is dealing with malabsorption, what are the subtle, or sometimes maybe not so subtle clues we're looking for? What are the biggest red flags?
Well, the absolute hallmark sign, the one that usually prompts an investigation, is chronic progressive weight loss. And here's the kicker. This happens despite the horse having a good appetite and actually eating enough food. They're taking in calories, but they're still sort of wasting away. It's truly a mystery for many owners.
Yeah, that's the scenario we started with, the one that stumps so many people.
So beyond just the weight loss, what else might you notice about a horse struggling with this? You'll definitely see poor body condition, a visible loss of muscle and fat, making them look thin and well drawn. Now, here's a surprising point, and it's a critical distinction. While diarrhea can occur, it's actually quite variable and often not present. A horse can have pretty extensive small intestinal disease and show no diarrhea at all because the large intestine, further down the line, can surprisingly compensate for a lot of the fluid absorption. In adult horses, in fact, severe diarrhea usually points to a problem in the large intestine, not necessarily small intestinal malabsorption.
Wow, that's huge.
Oh,
So if you're just waiting for diarrhea as the main sign, you might be missing the whole picture. What are some of the other, perhaps less obvious clues then?
Other signs can include ventral edema, which is swelling under the belly or maybe the legs. This happens because of low blood protein, especially albumin, indicating the intestine is literally leaking protein. We call that protein-losing enteropathy, basically a disease of the intestine causing protein loss. You might also notice a rough, dull hair coat, maybe overall lethargy, and decreased performance. Recurrent colic can happen, but it's probably less common as a primary sign of just malabsorption itself.
Okay, so we've got these mysterious symptoms. What's actually happening on the inside? What are the underlying causes that lead to this breakdown in the ability to absorb nutrients?
At its core, malabsorption is due to damage to the small intestinal lining, or maybe a reduction in the surface area available for absorption, or even an obstruction of the lymphatic system, which is crucial for carrying absorbed fats away. One of the most common culprits is inflammatory bowel disease, or IBD. We often see types like lymphocytic plasmacytic enteritis, where immune cells infiltrate and sort of damage the gut lining, making it much less efficient at absorption.
So these are all different forms of inflammation just messing with the gut's ability to do its job properly. Are there other serious causes, like beyond inflammation?
Unfortunately, yes. Cancer can also be a cause. Alimentary lymphosarcoma, which is a type of lymphoma, can extensively impair absorption by infiltrating the intestinal wall and the surrounding lymph nodes. Then we have infectious diseases. Lawsonia intracellularis infection is particularly significant, especially in weanling foals and yearlings. It causes what's called equine proliferative enteropathy, or EPE, where the intestinal wall actually thickens up dramatically, severely reducing its absorptive capacity. Other things, like chronic, heavy parasitic burdens from strong styles, can also cause significant intestinal damage over time.
And what about physical or structural issues? Are there any sort of oddities there that can cause this?
Yeah, absolutely. We can see problems after, say, an intestinal resection if a significant length of the small intestine had to be surgically removed for some reason. Lymphatic obstruction is another sneaky one. This can involve something called lymphangiectasia, where the lymphatic vessels in the intestine dilate and just can't drain properly. Or you might have enlarged lymph nodes in the mesentery that physically compress and block that lymphatic drainage. And finally, for foals specifically, there's congenital or acquired lactase deficiency, essentially lactose intolerance in young foals, kind of like what you see in some humans. All these conditions can eventually lead to something called villus atrophy, which is damage to the tiny finger-like projections, the villi, that line the small intestine. They're absolutely vital for nutrient absorption.
Wow. So we've got this really complex web of potential problems that can lead to malabsorption. How do veterinarians actually pinpoint if malabsorption is occurring? And then, I guess, if it is, what kind it might be? This sounds like where the real detective work starts.
It really does, yeah. This is where intestinal absorption tests become invaluable tools. The core principle is actually quite clever. You orally give the horse a specific type of sugar, and then you track its concentration in the blood over a period of time. If the blood concentration rises significantly, it tells you that sugar successfully made the journey from the gut into the bloodstream. It's like, tracing a nutrient's path through the body.
And the most common of these, I think, is the glucose absorption test.
Right.
How does this test give us clues about what's going on?
Right. The glucose absorption test, or OGTT. Glucose is a simple sugar, a monosaccharide, that's absorbed actively. That means it uses specialized doorways or transporters, specifically the SGLT1 transporter in the small intestine. Crucially, it doesn't need to be broken down by digestion first. So if a horse shows reduced glucose absorption, it's a pretty direct indicator of a problem with the small intestine's ability to absorb those vital, simple nutrients.
Okay, so walk us through the procedure for an adult horse. What does it actually involve for the horse and the vet team?
Okay. First, the horse is typically fasted for about 12 to 18 hours. This is really crucial because we need their digestive tract to be as empty as possible so other food doesn't interfere with the glucose absorption itself. Water is usually allowed, but often restricted during the first couple of hours of the test. Then, a baseline blood sample is collected before anything is given. After that, a precise amount of D-glucose, and it's important that it's D-glucose, a pure form, not just any sugar like dextrose, for the most accurate results, is given via a nasogastric tube. It's usually dissolved in warm water at a specific concentration, like 20%, to ensure proper absorption.
And then you're basically tracking its journey, right?
Yeah.
Monitoring the blood.
Exactly. You then collect multiple blood samples at set intervals, typically every 30 to 60 minutes, for up to 4 or maybe even 6 hours. And throughout this whole process, the horse is closely monitored for any signs of discomfort or potentially laminitis, as a large sugar load can sometimes cause issues in susceptible horses.
Okay, so you've got all these blood samples. You plot the glucose levels over time on a graph. What does that curve actually tell you about what's going on inside the horse?
Well, in a healthy horse, the blood glucose will show a clear peak, usually somewhere between 90 and 150 minutes after giving the sugar. That peak should be a significant rise, typically at least 60 to 100% above baseline, or sometimes we say more than 85% above. Basically, you want to see it roughly double. Think of it as a clear upward curve showing, robust absorption.
And if there is a problem, what do those curves look like then?
Right. If you see what we call partial malabsorption, the glucose level will rise, but it just won't reach that normal peak. It's a blunted response. This indicates that, okay, some absorption is happening, but it's not efficient. This could point to maybe reversible issues like mild villus damage or some inflammation. Now, if it's complete malabsorption, you'll see essentially a flat line, virtually no significant rise above the baseline level at all. This is often associated with severe progressive inflammatory or maybe even cancerous infiltration of the gut, and unfortunately usually carries a very grave prognosis.
But I'm guessing it's not always a perfect, straightforward diagnosis just from looking at that curve. Are there complications?
You're absolutely right. While it's sensitive, it picks up problems well. It's not highly specific for the exact underlying cause. Lots of factors can influence the results, potentially leading to false positives or negatives. Things like delayed stomach emptying, or very rapid intestinal transit time, or even stress from the procedure itself. Plus, it requires the horse to be hospitalized and undergo multiple samples, which can be logistically challenging and, expensive.
Okay, so that brings us to the xylose absorption test, which I know some vets consider perhaps a more accurate indicator. Why is that? What makes xylose different?
Yeah, D-xylose is another simple sugar, a pentose. But it's absorbed mostly by a simpler process called passive diffusion across the jejunum, although there's also an active carrier involved. Crucially, it's not actively transported, quite like glucose. And here's the key. It's not significantly metabolized by the horse's own tissues. This makes it a more direct and arguably specific indicator of the small intestinal lining's integrity, less influenced by the horse's overall metabolism or insulin status, for example. Plus, it's not normally found in the blood, so any rise you see is clearly from absorption, simplifying the interpretation a bit.
Right, sounds like it gives potentially a cleaner signal then. How does its procedure differ from the glucose test? Is it simpler?
The procedure is actually quite similar. Same fasting period, baseline blood sample, and then the D-xylose is given via nasogastric tube, often at a similar dose and concentration. The main potential difference is that blood samples collected over about 2 hours are often sufficient for interpreting this test, making it potentially a little quicker than the full glucose test.
And the interpretation. What are you looking for there?
It's similar. A normal response shows a clear peak in xylose levels, significantly higher than baseline, usually occurring within that same 90 to 150-minute window. A blunted or absent rise indicates malabsorption, similar to the glucose test interpretation.
Are there any downsides to using the xylose test instead?
Yeah, there are. D-xylose itself can be more expensive and sometimes less readily available in certain areas compared to glucose. It still shares those practical challenges, the prolonged sampling, the need for hospitalization. And like the glucose test, its curve can also be affected by factors like stomach emptying, how fast things move through the gut, mucosal blood flow, even bacterial overgrowth. It's also worth noting that many commercial diagnostic labs don't routinely process xylose samples, which is probably why the glucose absorption test often remains more common in everyday veterinary practice.
Okay, that makes sense. Now, there's one more highly specialized sugar test, and it's absolutely crucial, as you mentioned, to know who this one is for. The lactose absorption test. Why is this one so specific just to foals?
Yes, this test is almost exclusively used for young foals, generally those under maybe 3 or 4 months of age. And it's specifically to diagnose lactase deficiency, which, again, is essentially lactose intolerance in foals. This is critical because adult horses are naturally lactase deficient. They just don't produce the lactase enzyme anymore. So giving lactose to an adult horse would almost certainly cause colic and diarrhea, and getting an abnormal result would actually be perfectly normal for them. It would be completely useless for diagnosing malabsorption in an adult. You'd basically just be making them sick for no reason.
Right, so it's really only useful for checking if a foal can break down milk sugar, which they obviously need to do.
Exactly. Lactose is a disaccharide, a double sugar. It absolutely requires the enzyme lactase, which is produced right there on the small intestinal lining, the brush border, to break it down into simpler sugars, glucose and galactose, before they can be absorbed. So this test helps assess if that enzyme is present and working properly. It's often indicated in foals that have persistent digestive issues and diarrhea, maybe following a gut infection like rotavirus or Clostridium difficile, which can damage the lining.
How does the test actually work for these little ones?
The foal is fasted for about 4 hours. Often they need to be muzzled to prevent nursing. A baseline blood sample is taken specifically for glucose. Then lactose monohydrate is given via nasogastric tube, again, usually as a 20% solution at about 1 gram per kilogram. Blood samples for glucose are then collected at intervals, maybe every 30 minutes, over about 3 hours. And the foal shouldn't have access to water during that first hour.
And what would a normal result look like for a healthy foal?
In a healthy, normal foal who has plenty of lactase, their blood glucose concentration should roughly double from baseline, or at least show a significant increase, say, by 35 to 50 milligrams per deciliter within about 60 to 90 minutes. If the foal is lactose intolerant or has broader malabsorption, you'll see a delayed, blunted, or maybe even completely absent glucose increase. And you might also see signs of abdominal discomfort or diarrhea develop because that undigested lactose starts drawing water into the gut.
This sounds like a really crucial diagnostic step for those specific cases, but it also sounds like you really need to connect it to the other test to get the full picture right.
Oh, absolutely. You absolutely do. If a lactose test comes back abnormal in a foal, the next logical step is usually to follow up with a glucose or maybe a xylose absorption test. This helps us make a critical differentiation. If the lactose test is abnormal, but the glucose or xylose absorption is normal, it tells us the problem is specifically maldigestion. They can't break down the lactose because they lack the enzyme, but they can absorb simple sugars just fine once they're available. However, if the lactose test is abnormal and the glucose or xylose absorption is also abnormal, then it points towards a deeper malabsorption problem. That indicates actual damage to the small intestinal lining itself, affecting its ability to absorb any simple sugars, not just those from lactose.
Okay, so we've walked through these incredible sugar absorption tests. They're clearly powerful. They tell us if absorption is happening properly, but they're not the final answer, are they? They don't tell you why the problem is there.
No, exactly. They're really just one vital piece of the diagnostic puzzle. While these tests are great for confirming that malabsorption is occurring, they are, by nature, nonspecific. They don't identify the exact underlying disease process causing the poor absorption. They're like a big red flag waving, telling you there's a significant problem in the engine, the small intestine, but not whether it's, a spark plug, a fuel pump, or something much more serious.
So once you have an abnormal absorption test result, what comes next in the diagnostic detective story? What further investigation is typically needed to really pinpoint the cause and figure out how to treat it?
Yeah, so an abnormal absorption test definitely warrants a more comprehensive investigation. This might include things like a rectal biopsy. It can sometimes reveal inflammatory changes, although it's a fairly superficial sample, so it might miss deeper issues. An abdominal ultrasound is very, very useful. It lets us check the small intestinal wall thickness, as it's often significantly thickened in conditions like IBD, lymphoma, or that Lawsonia infection we talked about.
Are there more direct ways to actually look at the small intestine itself?
Yes, definitely. Duodenal endoscopy and biopsy allow for direct visualization of the very first part of the small intestinal lining, the duodenum, and let us collect more representative biopsies from that area. But what's really considered the gold standard for a definitive diagnosis of small intestinal pathology are laparoscopic keyhole surgery, or even full surgical full-thickness biopsies. Now, these are obviously more invasive, but they provide the most comprehensive tissue samples, often allowing for a definitive diagnosis when other methods are inconclusive.
What about simpler initial tests that might be done alongside or before these?
Oh, absolutely. Fecal testing is always important. You need to check for parasites, things like Salmonella, Clostridium, other potential infectious agents. There are also more experimental or specialized tools like nuclear scintigraphy, which can sometimes help assess gut function, but it has significant limitations. It requires specialized equipment, and you can get false negative results.
So it really sounds like it's about bringing all these different pieces of information together: the history, the clinical signs, the blood work, the absorption tests, the imaging, the biopsies, for the vet to make an accurate diagnosis.
Exactly. That's the bottom line. Interpreting these absorption tests requires significant clinical experience, and they absolutely must be integrated into a full diagnostic plan alongside all the other findings. This kind of comprehensive approach is absolutely essential to correctly identify the specific underlying cause of the malabsorption and ultimately ensure the horse receives the most appropriate and effective treatment possible.
Wow. What an incredible deep dive we've taken today. We started with that really baffling mystery of a horse losing weight despite eating well, and we've journeyed deep into the intricate dance of digestion and absorption in the horse. We've seen how these clever sugar absorption tests can act as vital diagnostic detectives, revealing those hidden digestive problems. And crucially, how that's often just the beginning of the detective work required for a full diagnosis and treatment plan.
It truly highlights the incredible complexity, but also the resilience of a horse's internal systems, and how a seemingly simple symptom like weight loss can have such a profound and often hidden cause underneath it all.
Absolutely. And when you really consider the intricate processes we've unpacked today, the specific enzymes needed, the specialized doorways in the gut lining, those delicate villi doing all the work, it truly makes you appreciate the silent, complex work happening inside every living creature, doesn't it? This deep dive into equine health reminds us that sometimes the most important information isn't right there on the surface. It's hidden just beneath it, waiting for the right diagnostic key, like these tests, to unlock its secrets. And understanding this complex interplay can make all the difference for an animal's health and well-being.